I'm here to talk a little bit about breastfeeding and breast milk and all that goes along with your early stages of your newborn and feeding your newborn. So I find it really important to explain how your body makes milk. That's one of the biggest challenges that I find with most of the moms that I work with is we live in a society where we're looking for a fix-all solution for most of our problems, and that includes breastfeeding. And so it's really important to understand how our bodies make milk so that we're not getting caught in the traps of things such as lactation cookies and things that may not work for you. So what's important to understand is our body makes milk through what's called lactogenesis. And there are 3 stages of lactogenesis, 1, 2, and 3. Lactogenesis 1 starts during your pregnancy. So this is completely hormonally driven, and you don't really have to do anything to bring this on. And some moms will experience that they leak a little bit at this time, and you may not. Both are normal. Now, as we go on further into our pregnancy, we of course start with labor and we deliver our baby, but we also deliver our placenta. And with the delivery of our placenta brings lactogenesis 2. So lactogenesis 2 is also completely hormonally driven, but it's important to understand that it's mechanically sustained. So one thing I want everybody to be aware is that the first 6 hours of baby's life is really important to remove milk from the breast, to hand express if you have to, but get that milk into baby, because it's proven scientifically that those first 6 hours are really what are going to drive the rest of your breastfeeding journey and your ability to make a very healthy supply, which you will be able to do regardless, but it will really help to drive that supply and demand. So when I say that it's mechanically sustained, this is removing milk from the breast. So what's important to remember about colostrum is that it is medicine, and the more we give out, the more we are filled up. Now, colostrum is extremely high in calories. It's very condensed, complete nutrition, but it's also the perfect nutrition to set the precedence for your baby's gut health for the rest of their life. Now, colostrum is known as liquid gold. It's kind of a gold color, and it's also extremely high in antibodies. So like again, I said, it's medicine. It's really important for your baby's immunity. Now, as time goes on, within a few days, sometimes a week, you will start the transition into lactogenesis 3, which will be the final stage of your breastfeeding journey, and it will go on for however long you decide to breastfeed. For a lot of people, that looks like a year, 2 years. Setting small goals is really important because once you reach those goals, you can go further. And I find it's not as overwhelming if moms set smaller goals. The World Health Organization does recommend breastfeeding until the age of 2 and beyond. So breast milk doesn't stop being nutritionally important. It continues to be completely nutritionally valuable for the rest of your baby's breastfeeding journey, however long that may be. Lactogenesis 3 is completely mechanically driven. There's no longer any hormones that are involved here. As long as your hormones are completely balanced, the more we give out, the more we are filled up. So the more that you feed your baby on baby's cue rather than trying to keep a schedule, and sometimes that does mean that you do have to wake baby a little bit more often than baby would like, especially in the beginning. But again, on baby's cue is really important to drive a healthy supply in that final stage of breastfeeding. So next we're going to talk a little bit about latching your baby, latching and positioning, but first we'll talk about latch and go into positioning as we go on further with this. So when it comes to latching your baby, it's all about how you hold your baby. A lot of moms tend to want to bring their bodies to baby instead of baby to their bodies, and so it's kind of important in the fact that that can be detrimental to the health of your nipple if you are damaging your nipple by trying to bring your breast to baby instead of baby to your breast. So one important thing is to have baby belly to belly with you. For mothers who give birth vaginally, this can look like this, but for mothers who are trying to avoid a C-section incision, it will look more like this, sometimes even more like this. So having baby belly to belly, and it's important that baby isn't swaddled. We want baby to be able to use their hands freely because baby doesn't have very many senses right now. So allowing baby to use their arms to feel where they're heading is really important. So baby is belly to belly, and allowing baby to have his hands around you is great. we want to hold baby behind the ears. So a lot of us want to hold baby's head nice and sturdy and make it nice and secure, but this can actually make breastfeeding a little bit harder for baby because they're not in control of the situation. They like to be in control. They like to have freedom of head movement. So holding baby right around the neck behind the ears allows baby to be able to move their head more freely. So we bring baby nose to nipple, and sometimes at this point, baby will be ready to root and will start shaking his head very vigorously. But if not, we can stroke the nipple from the nose to the chin and back up a few times sometimes to create a reflex to have baby open a little bit wider. And again, baby may start rooting, and this is when you bring baby in. Again, baby to nipple, not nipple to baby to breast, not breast to baby. So when offering the breast to baby, it's important to remember that you can always shape the nipple as well. So you may have heard this called the hamburger hold. You can just compress a little bit to kind of give the nipple a shape. And also flipping the nipple up will help a lot to get baby on deeper. So what's really cool about the breast is there's little bumps called Montgomery glands. And these Montgomery glands secrete a lubrication that smell like amniotic fluid. So baby was floating around in amniotic fluid for 9 months in utero, so it kind of smells like baby's home. And being skin to skin with your baby is really helpful, and this really helps baby when breastfeeding, especially for the non-latching baby, and that helps baby to get a deeper latch. So when we're assessing baby's latch, baby's mouth should be open wide and lips should be a little bit flanged. It's not important that they are terribly flanged. I know a lot of moms will look for that flanging and baby just doesn't have it, and that's okay. There may be a little bit of sensitivity or uncomfortability, but there should be no pain. If there is any type of pain or you're just intuitively feeling like something is not right, that would be a great time to reach out to a community resource such as an IBC or an IBCLC. But the chin should be resting on the breast. It will look a little bit off-center. There's no need for baby to have a bullseye latch. You may notice a bit of the areola peeks up a little bit further towards baby's nose, but the rest may be kind of invisible. So lastly, in latch positioning, we want to talk a little bit about assessing milk transfer. So this is really important for mothers when they just don't know if baby is getting enough milk, or they're being told that maybe your baby isn't getting enough milk. Because unfortunately, we can't see how much baby is getting unless we're feeding bottles. But there are a few good ways to tell that baby is getting proper transfer through a proper latch. So when baby is latched, you can look for ears wiggling a little bit or jaw movement of suckling, but also satiety. So if baby is satisfied after a feed, that's perfect. If baby breastfeeds to sleep, that's wonderful. Sometimes baby isn't satisfied right after. Sometimes baby wants to cluster feed, and that's a good thing as well because that's really setting your supply and demand because baby just wants to remove more and more milk. Now, sometimes that can be a negative sign. So if you feel at any time that cluster feeding maybe isn't going so well, that would again be a good time to reach out to one of your local resources. Now, also with assessing milk transfer, this one is the most important, is really assessing the poop and pee output of baby's diaper. So by day 4, we look for 4 poops and 4 pees. If baby really isn't catching those 4 poops and pees around that time, it might be a good idea to talk to somebody as well and make sure that baby is getting proper milk transfer. Another thing I want to talk a little bit about is hand expression. So this is really important for the non-latching baby, especially in those first 6 hours that we talked about, getting that milk removed from the breast. I don't want you to be bruising your breasts or wringing them out so hard that it's painful. So this is why it's really important to learn how to do it properly. You can actually massage the breast a little bit to get things flowing. Heat works great, a shower or a warm compress. But hand expression just looks like press, compress, release. Press, compress, release. And once you get into the rhythm of it, you will see the milk starting to flow. It may not happen immediately, and that is okay. So next I want to talk a little bit about positioning. We're taught pretty frequently the cradle hold. So the cradle hold looks just like this. It's pretty common, we see it in pictures, but it's also the least natural. So I want to talk a little bit about more comfortable ones and ones that may be very important in your breastfeeding journey, especially for the non-latching baby. So following all the steps that we talked about prior, the first one that I always teach moms is called natural breastfeeding, and this is actually a laid back position. So when you're in your bed or in your recliner or somewhere that you're comfortable, have lots of pillows on hand you can rest your arms on, but also prop baby up. You're just going to lay back nice and easy, and baby will rest on you. Again, belly to belly, nice and high. We don't want to be bringing yourself to baby, baby to yourself. So this is just nice and laid back. So when we're doing natural breastfeeding or laid back breastfeeding, it's important to remember that we are going to have baby belly to belly. So this may help to have pillows on hand so you can rest your arms on, to rest baby on. A couple pillows is actually great, or a boppy pillow. And we are just going to simply lay back. So this looks just like this, and baby is nice and rested on us. Now this is an important position because gravity allows baby to be pulled deeper onto the breast. So again, like I said, for the non-latching baby, this can be a really helpful position. Now this can be done on your recliner, in your bed, anywhere where you are most comfortable. So the next one I want to talk about is the side lying position. So this one is nice and comfortable for mom and baby because you can be in your bed and just lay on your side and have baby cuddled up with you. Now this may be for older babies. It's not always for the newborn, but some newborns are more comfortable in this position, so it wouldn't hurt to try. So this is the side lying position. You're generally comfortable in bed with your baby and you can cuddle up nicely. Baby will also be on their side. You can use a pillow behind baby's bottom to keep baby propped up nice and comfortably. You can also use a pillow behind your own self to help yourself be propped. Sometimes a pillow between your legs is nice too. But of course, pillows on your arm and around your arm, around your head, whatever is most comfortable for you. The reason this is a good position is because it's more comfortable for mom and baby, and mom can get some relaxation in while she feeds her baby. So we also have the cradle hold position as well as the football position. So earlier you seen me demonstrate a latch. Now that was pretty much the cradle position. So we have our hands right on baby's head, and this would be the cradle position. And the next one will be football. So this is pretty easy to transition, especially from the cradle position. And that just looks like this. We just slide baby over. Baby is tucked underneath our arms. It's important to remember to have baby belly to belly. This one you can also use your right hand to shape your breast as well as you could as the cradle hold. Now this is a good technique for babies who have maybe had a more traumatic birth. So a lot of times when babies get stuck in the birth canal, you may find that baby doesn't want to latch on one side versus the other. So sometimes if you can get baby to latch in a cradle hold on one side but know that they won't on the other, it's super easy to just transition baby over to the football, starting with the cradle that they were already comfortable in.